What makes therapy therapeutic? This is an essay I wrote for my Substack, The Saudi Therapist. My name is Asil Abu Rashid. You can find me also on Instagram as Asil the Therapist. I'll do my best to read it out. So, the question. Let's think about therapy. You sit with a stranger and talk about your pain. You don't know what they believe, what are their values, how they live their own lives. For generations, people brought these struggles to family and to friends and spiritual leaders, people who share our values. So, why a therapist? What is it that a therapist does that's so therapeutic? And what does that mean when I go to a therapist? That all else in my life failed, and somehow the therapist has the answer that everybody else doesn't? I have gotten this question from family members trying to understand what is it I do as a therapist, from people that are considering therapy for the first time, and even people who are desperate to help their own family members, hoping that by me answering this question, they could sort of capture what is it that a therapist does so they can do it themselves for their own family members. The idea that a stranger could help you or help your family members better than you do is a very strange idea and also very painful to believe. All of these things are questions I have got from very honest people, and also I have thought of myself. Working in mental health, a lot of what we do is right in between theory and reality. And research can tell us, for example, what technique is better than another, or for whom is this technique more appropriate, under what conditions. But what research does not do is calm the heart of a concerned father. So a father is not asking what technique has the better effect size. These are things we learn in statistics. He wants to know what is his daughter getting into, what actually happens in therapy, what makes therapy therapeutic, because it does not seem very logical to think that just talking about your problems and with a stranger somehow will make it better, because we could do that at home. It's a very hard question for me to answer, but let's study it together, see where it takes us. I'll do my best not to wander off and go to the heart of the matter, and if I do wander off, please let me know. So, number one is wisdom. Let's start with this. I've known plenty of therapists that they themselves are confused about life, or they are struggling with their own lives, and still they go to work and they're very competent. So whatever it is that makes therapy therapeutic is not the therapist's depth of wisdom. I'm sure that's not it. When I was an undergrad, I wanted to be a psychoanalyst. They are a kind of therapist that follows the tradition that does more interpretation of pain, and so understanding the pain more than they focus on just making it stop. It's more of an art than it is a science. Of course, that posed a lot of problems, which is why it's not as popular. One thing that fascinated me most about psychoanalysts is that as part of their training, they had to go through years of therapy themselves, called analysis, before they could practice as analysts. Their tradition took seriously the idea that therapists needed to do their own inner work to become, in some sense, wiser. However, like I said, that's not how most therapy works anymore. Our understanding of psychological pain has become more medical. For one, we don't call it psychological pain, it's called mental health disorder. Therapy is more protocol driven. So we use techniques, worksheets, exposure plans. These don't require a great deal of depth and psychological wisdom. Your therapist, like your doctor, might not be any more wiser than you are. Perhaps there's something that all therapists share, some common technique that runs through all kinds of therapy. No, not really, because there isn't such a thing. The field is sort of scattered. There's the behaviors, there's the Jungians, there's the trauma specialists working with different philosophies, sometimes even speaking a completely different language. I personally know many therapists that do not follow a certain philosophy or school of therapy. They just learn as much as they can. They try a lot of things in their clinics until they find some sort of a practice that is practical and works, and this is what they do. So the idea that there is something common between our therapists might be there, but it's not systematic. It's not something I can identify and tell you that is it. So it's not wisdom. It's not some unifying technique. So let's keep looking. I won't keep saying it's not this, it's not that. There is something that it is. It's safety. At the very least, in therapy, there should be an expectation of privacy. The idea that your privacy will be respected and your welfare will always come first. In practice, that means that the therapist is not allowed or shouldn't put their needs above yours, not their emotional or financial or in any kind of way put their needs above yours. If something goes wrong, there should be accountability. This is why we have supervision. When your therapist mentions that, oh, I have to record a session, or that everything you say is confidential, but I may discuss some things with my colleagues. That's that structure of accountability working in the background. A system that makes psychotherapy possible. That is very important, I think, in our day and age. Is that framework therapy itself? No, but it allows for therapy to happen. Keep in mind, I just want as a side note to say that these structures are not always perfect. In some places there is more oversight than others, so I always encourage you to understand who your therapist is accountable to, and ask if they have a supervisor, even maybe who their supervisor is. That's fine, you can ask that. It's never, ever rude to ask. People ask us these questions all the time, and we should be prepared to answer them. Because you are part of this system, you should know where you stand and what is going on. But let's go back to our subject and say that then what is it that therapy does? One thing that I think is very important is the space. When there is psychological pain, we dedicate our time to it, whether in a clinic or in a private practice or in a Zoom call from across the world. We are creating therapeutic space. I'm careful here not to say fix the problem or get rid of the pain, as if pain is a wound that needs to be cured or a growth that needs to be removed. I've seen very competent therapists disagree completely about this idea. But what I'm saying here is just that it's important to give the pain attention, however that attention may look like. I want to say a very short story. I remember once as a child, I was playing tag with my friends, so running very quickly, enjoying our time. And of course, in Greece, many old neighborhoods have very rough gravel roads. Even driving over them with a car feels like you're in a safari. So, of course, I slipped, I fell, and scraped my knees, both of them, on that road. And I just instantly knew it was bad. I looked down and I saw a mess. My knees looked terrible. So I immediately started crying. At home, my grandmother was taking care of me, nursing me back to, air quotes, back to life. And she was using these cotton balls with the red stuff, I used to call it, betadine, we used to call it. Um, I was still kicking and crying when my grandfather walked in, and as a joke, he's like, "Hey, my neighbors called. They said you're crying," as a joke, just to say that I was crying so loudly. And he came to me. He put on his reading glasses, and he said, "Okay, I'll say, let me look." And as a joke, he said, "Oh, look, one thing is for sure. Until you get married, you'll be fine." It's a thing. It's a phrase Greeks say, and he says, "But for now, I think you'll need a wheelchair." He was joking around. I was not having it. I was crying. I was, not playing along. And he told me, "Look, Asil." He told me, "Look, you scraped your knees." He says, "Look, Asil, it doesn't look that bad." He could tell that I was just even afraid to look at it. So I peeked. I looked, and actually, after my grandmother took care of me and cleaned it up, it really looked fine. It just looks like I had a few scrapes. And embarrassingly, I realized that I was just kicking and crying because I was not in pain, because it didn't hurt. I was just very, very scared of what happened to me. And and I say this story because it helped me realize that sometimes we need to take a moment and look at the pain. This therapeutic space pulls us out of the loops we've created in our lives. So, the self blame, the job that follows us home, the regret, the cigarettes, the smoking, the shopping, the scrolling on our phones, all of these things are sort of a loop that keeps us away intentionally or unintentionally from our pain. And then sometimes the pain comes up in inappropriate times when it's not the right time for us to practically, it's just not the right time practically to address these things. So having that space is very important. Having it in a scheduled time with some kind of structure really widens the space even more, because you and I know, of course, how one good, honest conversation is very helpful when we are in need of it. So imagine knowing that you will have that at some point, and also that it may happen not just once, but it's reliable. You know it's there. That really, really widens that space for us to think and consider and look at our pain. So I think personally, I feel like we are a little bit closer to understanding what is it that therapy does. Um, but something still, because I really want to go to the heart of the issue, and I can imagine somebody telling me, hey, look, I mean, I can have this same kind of space to look at my pain with my wife, with my grandfather. Even going out for a walk is a sort of space for me to think. Even prayer, for example, people would say that. Why therapy? So, my answer to that is psychology, our study. So, everything I mentioned so far, in some way or other, could be part of somebody's life. People who are looking for, we could have people who are looking out for our best interest, that could be us even. We could have the space to look at our pain with them or with ourselves. It could even be regular and reliable. I mean, that is very possible, something we could have in our lives. What is unique about therapy is that we have that space with somebody that's thought very carefully about how to use this space in the best way possible. So far, I've deliberately not mentioned any kind of therapeutic technique. Not because I don't believe in them, I do, but techniques work best when all of these things are in place. The ethical framework, the dedicated space. Once these are there, the training that we have as psychologists or therapists really does matter. So therapists have given a lot of thought about what they do, or at the very, very least, their supervisor has, or even at the very least, the people that developed the frameworks we have and the ideas have put in the thought. This lineage of care and attention is real and is important. But look, somebody could still tell me, but can't anyone just read the psychology books and understand these therapeutic techniques and apply them to themselves and their family members? So, if you read the books and you do the training and you put yourself within this ethical and legal system, then yes, you can do exactly what a therapist does. Essentially, that is what a therapist is. I'm saying this because I really hope it can demystify what a therapist is, and really ground the idea in reality. I don't want us to think too much of them or too little of them also. Hopefully, it gives some balance enough to realize that therapy is not something to take the place of your family, your spirituality, but something to one more thing that we can add to the things that are helpful in our lives. So that doesn't mean that when you walk into a therapy room, everything else failed you, or we put everything aside and we put all our confidence in this one person with this one theory or technique. If you really believe that you're working with somebody who has done their best to be helpful to you, that means that your family, your faith, your values are still part of what will help you get better. What I can say to a concerned father is this: therapy brings together a lot of things that have the potential to be helpful. Therapists should have the responsibility of trying to keep all these things together and do their best to put your needs first without putting aside your beliefs and your strengths. However, still, I always tell people that I refer to, for example, to other therapists, even if I know them well, understand who your therapist is accountable to, ask as many questions as you need, and it's never ever rude to ask these questions. I would not have written this if it wasn't for people asking me these questions very bravely, very honestly, opening up and really trying to understand what is it that we do. So if you are one of these people, thank you very much, first of all. Thank you for listening, and I hope you have a good rest of your day. Bye bye.